Thank you. Thanks. What a great panel. Thank you so much. I want to ask the next panel to come up. And the next panel is really learning about spread and scale from the tobacco experience. And I want to introduce our moderator for that, which is Michelle Larkin, who is Assistant Vice President at the Robert Woods Johnson Foundation. And I want to add that Carrie Ann McCreary was also part of our planning committee for this, from the Robert Woods Johnson Foundation. They've done a lot of great work in this area. So with that, let me toss it over to you.
Thanks. Good afternoon. So everybody do me a favor. I know we just came in, and let's stand up for a second. We have some low energy. Come on, seriously. Pamela, I see you. We actually have a great panel of folks. I actually want the other one first. A great panel of folks with us today. We have Cheryl Hilton, who is now at, excuse me. Let me make sure that I have my glasses on. I wish I had them with me today. Cheryl is actually the director of the Global Institute of Public Health and Dean of Global Public Health and Professor of Public Health at New York University. Prior to New York University Wagner Graduate School of Public Service. Cheryl was also the previous CEO and president for American Legacy Foundation, and she's going to be sharing with us the work that they had done around spread related to quitting. And then Brian King is the senior scientist for the Office on Smoking and Health at the Centers for Disease Control. Jeanette Noltanius is director of the National Latino Tobacco Control Network at Washington, D.C., and Sally Herndon is the director of North Carolina's Tobacco Control Network, head of their Tobacco Prevention Control Branch at the Division of Public Health at the North Carolina Department of Health. And I take a little time to call out their brief bios. Their more extensive bios are in your packets. But I think it's really important to get a sense of, we have a really nice mix here of people who are working in community-based organizations, in national networks, in state departments of health, in federal agencies, and in foundations and universities as well. And I think it's important to note that these are partners who sometimes work well together and sometimes don't. I have the privilege to say that with the exception of Brian, although I did come from CDC's Office on Smoking and Health a long time ago, I've had the pleasure of working with each of these folks, and the contributions that they have made to tobacco control for our nation has really been incredible, and I'm looking forward to hearing the stories that they'll share today. I wanted to just give you a sense of spread. So this is statewide, and I note statewide because you're going to see the maps change in a minute, and you might say, well, I know in that state they have this 100% smoke-free law that touches workplaces, bars, and restaurants. But it's probably not a statewide law. So here's statewide, 1998, 2005, 2008, 2010, 2014. Now on one hand, this is wicked impressive because we're actually seeing a movement spread fairly rapidly for tobacco control around clean indoor air. On the other, that's exactly right. Not the South. No, I like audience participation, I'm all right. But it's not the South. And I think that ties to some of the conversations that we've been having throughout the day of scale and spread are often, we have to really take in the local context and the adaptability. And who are the leaders that we're engaging? Who are the populations that we're engaging to make sure that we're engaging those folks who are from non-traditional partners oftentimes, and who can actually bring the voice and the credibility to the movement that we're looking to see. The other one that I wanted to share with you is this slide, because this is actually the percent of the population covered by smoke-free laws. And this is state and local, and you can see that we're only at about 50% of the population, a little bit over that, if you use a really stringent definition of comprehensive smoke-free air laws, which means that you're not exempting bingo halls, small businesses. It's great. We've actually had a great increase in what we've covered, but we still have a long way to go when we think about the total population in the United States and not being exposed to a really carcinogenic product and its byproduct. So, what do I hope you take away from this discussion today. I hope that you actually get a sense of how to engage non-traditional partners. I hope that you get a sense of how systems and networks can be leveraged in different and unique ways than we've been able to leverage them before. That's both people, organizations, and their connections, because that influences how we're going to be able to continue this movement, but more importantly, build a movement towards a culture of health in the United States. And by that, what that means for me is that as an asthmatic, I can go out to dinner in any state in this country and not have to worry that I'm going to end up in the ER. That my children can go to any ballpark in the country and be able to enjoy the game without ending up with ear infections or a chronic illness like I have. And it's that we can all live that healthier life. So with that, I'm going to turn it over to Cheryl to kick us off and to talk about legacy. And it should be open, but Colin will help us do